whatever helps you guys. Okay, so you want to verify that this is Mr. Smith, and you want to verify the order always that Mr. Smith is in fact going to get an IV. And then you enter the room and you perform hand hygiene. That's important. I'm an old school nurse and I'm always going to go to the sink before going to the hand sanitizer, but that's just me. You all have every right to go to the hand sanitizer. So I'm going to perform hand hygiene. I'm going to introduce myself. Hi, Mr. Smith. I'm Leanne. I'm going to be your nurse today. And the doctor has ordered for an IV, a saline lock to be placed. Could you verify your name and your date of birth for me? We got our 2 patient identifier out of the way. So Mr. Smith says, 12/17/1969, and says his name, and I say, great. So I've done that. I've done my hand hygiene. I ask him, have you ever had an IV before? Chances are he has. If he's an older gentleman, he has. And I listen to patients. If they say, yes, I'm a hard stick, I kind of go, oh. But if they say, yes, I've had them before, they don't bother me, that kind of thing. So that's what we do. We listen to the patients. For the most part, they're going to be right about IVs and how they feel about them. Or they may say, I'm deathly afraid of needles. So then you got to do a little more talking and going, oh, well, Mr. Smith, I'm not going to do anything without talking to you first, and I'm going to let you know, that kind of thing, just to kind of get his mind at ease. Well, this Mr. Smith doesn't seem to mind. So he just says, yes, I've had it before, I don't care. He's my perfect patient of the day. And then I say, well, give me a minute, I'm going to set up. So here are your things that you need to set up. Who wants to rattle off to me? We need IV start kit. What else do we need? Alcohol. IV extension tubing. My flush.
Catheter.
And I always bring 2 catheters in the room. I've been doing this a long time, and I always bring 2 catheters in the room because that wards off the evil spirits. So let's see, I have I have everything I need. My gloves will be obviously in the room. They'll be off the wall, but I'm going to have them set up there. And now you're going to set up your supplies now that you've got everything. So we've got our saline flush. And you guys have all of this equipment in your bags. How many sets do they have, Dr. Robinson?
There's 4.
Is there 4 sets? Okay. And
4 start kits.
Okay.
We have 3 syringes.
Okay.
12 catheters.
And when we go to practice, we'll kind of give you guys tips on, this, making them go longer, that type of thing. So, okay. Now, now the first thing I do is I open up my IV start kit. The facilities have similar IV start kits. We have our kit that's got everything you need. You're going to want to open this sterilely. In a minute I'll tell you why you may use this as your backup sterile boat. This is the sterile boat I choose after I've flushed my line, but this is my backup in case something happens to this. So I always have a backup. So I'm going to place it on the table and make sure my tourniquet doesn't roll. And then I just very carefully put that off to the side because I may use that. That's a pretty good one. I may use that. So I'm taking my tourniquet. Here is your commercially known as the Opsite Tegaderm, your occlusive dressing. I'm going to time, date, and initial it right now because we're not going to do this on the patient. That's not okay. Gosh, what is the date today? 21, 22? 21. Sure. And then that is done. This particular kit comes with gloves. I have my own. And a piece of paper I don't need. This chloral prep is what we'll have you guys use to clean off the area that you see when it's time to, after you place your tourniquet and you see a good vein. This chloral prep for practice as well as for SPD, we're not going to have you pinch it to break it, but just so you know, it's like a little vial that you go and then on over. So right now we're just going to open the package and have it ready. That's right here. My 3 pieces of tape. Now you guys can do this, this is the way I do it. And you can do this however. You can have your stuff set up mostly real close to the patient. You can move the table and have this set up here. You'll find your own way of how you do it. As long as you can reach what you need to reach, then you're fine. Let's see. Okay, now time for me to flush my extension tubing. Again, I'm going to pay attention to keeping this sterile, even though that one might be the one I use, but I always like my options. And what I'm going to do is have it stick out, because I'm not going to touch the inside of my potentially sterile boat. I'm going to go like this. And now I'm going to get my alcohol pad and I'm going to scrub my hub. Okay? And the way I just did it, since my hub never touched here, I don't need to scrub it. But if you guys take it and dump it, like I dumped the first bit, then you would have to. But I'm going to scrub it because most of you will dump it, and that's perfectly fine. So I'm going to scrub, 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 scrub. And then I'm going to connect the two. And it's a lock, lure lock that, ooh, almost didn't work. Lure lock that you guys are familiar with if you've seen them in the facilities. Then I'm going to bleed the line at the same time releasing the bubble. Good, that's enough. And then this is where my sterile boat, since I get a choice today, I'm going to pick the one closest to my patient's arm. And pay attention to the way the loop goes, because I've seen students not pay attention to the way it's bowed and kind of, you're nervous and you're trying to do it the right way and you've turned it and then it goes and flips out and you're looking at me like, uh-oh. So just pay attention and work with your loop and just place it right there. Good. All right. What's next? Now I'm going to look for a vein. At this point, when I touch patients, I put gloves on. You must put the gloves on before the venipuncture, but it's entirely up to you. If you're a novice with the tourniquet, sometimes it's harder with the gloves. And we're going to put it, the tourniquet, 4 to 6 inches above our site that we're potentially, our potential site. So let's see, I'm probably going to go right there for them, for Mr. Man. I do this business. I grab it, give it, you want to be taut enough that, you don't want to make his arm turn purple, but you need to have it tight enough to where you see some veins. So I take my 2 hands, I go cross it over this way, and put a nice little loop, just like that. And that way I can take my one hand and go and be done with it. All right, so Mr. Smith, I'm just checking for a vein right now, even though he's the one that's not nervous about it, but I'm just letting him know I'm not doing anything yet. Check for my site. Okay, I would like to go right there. I've chosen my site. And then, because I'm the novice nurse that I am, I'm going to release the tourniquet until I'm ready. I'm not going to keep that on his arm for the next several minutes. So I'm going to release it. And then go, when you find an area, you want to give it a good area, of cleansing. So we're going to go back and forth, left to right, up and down. Not cracking it because this is SPD and we don't want to ruin our mannequins. And then be done. I'm going to move this a little bit closer to Mr. Smith. And at this point, I kind of tell Mr. Smith, hey, I'm about to get ready, I'm getting ready to get started, Mr. Smith. Just don't move your hand for me. And he's like, okay, yeah. And he's watching TV. He doesn't mind. And so I'm going to, make sure I'm doing all this the way, yep. Now we're going to put the tourniquet back on and let Mr. Smith know that I'll be letting him know before I do the poke. You could have opened this before during prep. That would have been acceptable as well. And I'm going to open it and then utilize it, making sure my bevel is up. making sure, I've seen students put the square, not this, the alcohol cleansing pad, like at the tip of where they cleansed, because they might have forgotten where they cleansed or whatever, and you can do that, I've seen students do something like that, that's perfectly acceptable. Okay, Mr. Smith, we're getting ready to start, and I'll insert the catheter on 3. So you take and pull the skin down taut, and go in at a 15 to 30 degree angle. 1, 2, 3, Mr. Smith. You insert at this point in the SBD as well as, in the SBD we're going to say you have blood return. Our little arms aren't going to give blood to you. We're going to let you know you have blood return. And then once you see the blood return, you lower the catheter and advance it like so. You can utilize the way I did it with the 1 finger, or you can go like this with the second 2 fingers. The video I'll show you does it that way. Either way is perfectly fine. And then listen for the click. Look at that. Let go of the tourniquet. Let Mr. Smith know I'm almost done, but I have to secure this because you're not done yet. You can't breathe yet. We're gonna place 1 finger down on the vessel and occlude it. We're gonna take this, my index finger, and stabilize the catheter. And then I'm going to loosen it a little. Keep in mind I'm right here and I'm ready. And you don't want to touch the insertion site. I've seen a lot of students throw their finger over that insertion site. You don't want to do that, okay? You want to be very careful that your glove and your finger isn't touching this at the site. And then, so I've got my vessel occluded. I've got my index finger stable on the actual catheter. And now I'm going to go 1, 2, 3, pick it up, and go. And you just, until you can get it secure, you do not let this index finger fly up. Keep it there. You can almost breathe now. Now we're going to secure it with a piece of tape. As soon as it stops sticking to my glove. Now you can breathe. You have the choice. Here's your shirt. I always like to get rid of it. Now you want to flush it, and this is where we say simulate flushing, and we'll say in SPD it flushes well, or it flushed well, or however we say it. Great. So we're flushing it right now. It flushes well. We're going to release secure the clamp. We're going to release this, and I'm going to take my occlusive dressing. This is a little different than what you have in your kits. The one in your kit has just a divot at the top, but the divot is where make the divot go right on your, the entry point of your catheter. Like this one has a couple divots, but at any rate, we're gonna occlude this. And then put our time date initial on the side. You don't want anything to go over this IV insertion site, because this is what you're going to be assessing every 1 to 2 hours to make sure that it's good. Whether he's got fluids rolling in or whether he's got this lock. This is your assessment area. I've seen many, many IVs with tape all jacked up over the insertion site, and you just can't assess it properly if you can't see. It's especially important in infants and older people, because what are they more at risk for? Okay, infection. What else in regards to IV therapy? Infiltration. Think of a fluid going into a body.
Fluid overload.
Fluid overload, excellent. Both those groups of people are more susceptible to fluid overload. And how do we, as a nurse, it's just a question, as a nurse, how do we assess how do we know if someone's experiencing fluid overload? What's one of our signs?
Usually they'll start coughing and their lung sounds will get
The
bad.
lung sounds, rails, bad, okay? So yeah, that's good. Now I'm taping up as I was talking. I put the tape there, And I'm just gonna put the larger tape here. What you wanna do is make sure it doesn't come out. That's your goal in securing this saline lock. And so that right now, Mr. Smith doesn't have any fluids going through, but in 10 minutes he might, in an hour he might. So we wanna make sure, what's the point of placing an IV if it's not a good one? And after throughout the day it becomes a bad one, then we've gotta come back in here and re-stick Mr. Smith, and that's no fun for anybody, even if he doesn't care. He probably will care if you do it again. All right, so now you clean up your area. This will be for this, this will be for that, this will be for that. Well, I'll take my gloves off and then use this. Okay, and then you make sure that if you raised the bed when you came in the room to save our backs, you place the bed in the lowest locked position. You ask Mr. Smith, is there anything I can get for you while I'm in here, while I'm here for you? And he says, no, I'm good, I'm watching TV. And then you leave the room and you document. Are there any questions about IV placement? Do you need Mr. Smith's IV? Because he's going home. And so I've left the room. I come back into the room. I had Mr. Smith yesterday, but I'm still going to say when I go to do anything to Mr. Smith, I need your name and your date of birth, Mr. Smith, even though at this point I have it memorized. That's okay. And Mr. Smith tells me it's also a way to assess his mental status. If he's like, then I might want to go, do you remember what day it is? I don't know. I'm just saying, as a nurse, it's a good way to assess because we're constantly assessing when we're in the room. And so I say to Mr. Smith, you're going home, and now I'm going to take this IV catheter out. And he says, yeah, yippee skippy, life is good. I do my hand hygiene first, and then I prepare my supplies, which you can see they miraculously have been sitting here, but really in the real world they wouldn't be. But I have a piece of gauze. We also, some of the kids sometimes have to the room with my supplies. I needed gauze, and we're going to say that this gauze wasn't sitting there, of course. And I've got my gloves that I'm going to utilize, and my tape again. I'm going to take, this time keeping it fat, one piece of tape, maybe.
It's cheap tape.
Ooh, it is. Ooh, it is.
You also have a piece of, we have a tape, 1 inch paper tape, that if you don't want to use that one, you can always use your paper tape.
Well, that's not quite long enough, but, here we go. Woohoo. That's not good.
Making supplies cheaper and cheaper.
They are. Okay. Again, I make it a practice not to touch the patient unless, I'll pretend these look sterile, they're not. They're just clean gloves that I'm using because they were with me in my area. So I got the gloves off the wall, and I tell all my patients when I discontinue IVs, I've done this for all the 12 years or so, that the worst part is always the tape, and I let them know that. And so I just start by taking the tape off, and I can utilize my glove for the extra spare tape. If they are a hairy male, this way, towards the way the hair grows, is less painful. Against, doesn't feel good for them. So, Mr. Smith, this is always the worst part.
If
Ma'am?
that's been on there for a couple days, is it okay to use the alcohol prep on top to loosen it
I
up
have
and
seen
loosen it?
that. You mean to help loosen it up? I have seen that. In an older, frail-skinned gentleman, maybe not the best idea, although when you think about it, this may tear his skin too.
Yeah.
So you really have to use your judgment on with utilizing that, sir.
It's Sacred, it's Sacred Heart, we have the adhesion
Removal?
Yeah, it's kind of like a greasy,
Oh, it's
just kind of
greasy. Okay.
disintegrates the stickiness.
I've seen the ones that are alcohol, basically, I've read the, the ingredients and they're pretty much alcohol based. So it's like an alcohol pad, but
It works better.
it works well.
Mhm.
Does it come in the kits, or is it something you have to go
It's something I
get
have to
separate?
go get. Mhm.
Good idea. Okay, so I'm pretty much going, let's take this one off too. Going all the way around. And the last thing I uncover would be the insertion site. So I want to keep that protected as long as possible. And take my little tiny half a piece of tape and make sure that comes up as well. Okay. Oh, and my whole thing came off, and this does happen sometimes, so then I just place it there. And I've got my gauze. Now, this side was on the table. This side was up. Oops, no, it was up. Was up. And so you can turn around, and the up side, not the table side, can be the side that you place against Mr. Smith's skin. And so, all right, well, I've touched this side too. Well, it's not sterile. We're just covering it up. It'd be the same thing as a Band-Aid. So I turn around and go this side and double it. I put pressure here. I just kind of let Mr. Smith, hey, 1, 2, 3, take it out. What am I going to do with this? Checking it, yeah, making sure it's still there. I've had them come out not like looking like this, and it's frightening. And so you're like, oh. And so you're always wanting to check the catheter to make sure it's intact. Probably that's what I've done too. This too, per facility policy, whether it goes trash or sharps. For years and years and years, I put it in sharps because I didn't like the fact that they were all bloody. But most places, it's a trashable thing. Okay, so I'm going to place pressure on Mr. Smith's arm, and I've got the tape to secure my little mini Band-Aid. And how long do we put pressure on?
It depends if they're on
It's
coagulum.
good. It depends. It really depends. If you see a whole bunch of blood coming through that, you might want to go for a little bit longer, especially if they're on blood thinners. What if you got called into the next room? Hey, Leanne, I need you in the next room to help.
Ask them to.
Yeah, they got this arm. And you can go, Mr. Smith, put pressure on that. When it stops bleeding, you can take your Band-Aid off, because most people will do that. I've seen patients leave the lab at Eglin Air Force Base 1,000,000 times going, tearing off their bandage just as they're walking out. So people are going to take their bandage off when they want to. But you can ask Mr. Smith to help you, so you can go rescue somebody in the next room. Okay? Questions about anything? And then you want to clean your area. And pretend that's not there. Hand hygiene. Bed goes back down in the low locked position. Side rails are up. Mr. Smith, can I get you anything? Nope, just watching the game. Okay. And then we're gonna document that. What kind of things would we include in our note? Catheter tip intact.
No signs of infection.
Yes, no signs, symptoms of infection, edema. Good. All right.
I have a question
Yes.